Hello, I want to make a video about kidney transplant and complications that can happen afterward, and toxicity from the drugs that they use after a transplant, particularly Prograf. Um, I've never made a video like this before, so I feel kind of nervous and it feels really unnatural. Um, but I'm going to try to be brief because I feel like I can talk about this for a very long time and it's probably very boring. But I'm looking to connect with anybody out there who has had an organ transplant of any kind, and had difficulties with it afterward, difficulties with medication. I'd also like to talk to anyone who's interested in any of this, whether you're just a doctor or just anybody, basically. I also would love to talk with anybody who's achieved tolerance, transplant tolerance, which is extremely rare from what I understand. So I'm not really getting my hopes up. But anyway, my name is Hillary. I had my first kidney transplant in 2010. I was diagnosed when I was 4 or 5 years old with FSGS, which is they think it's like an autoimmune type disease, but it basically causes scarring of the filters of your kidney over time, and they're not really sure why it happens. No one else in my family has any kind of kidney issues on either side. But anyway, I got my first transplant in 2010, and the FSGS came right back in that kidney and destroyed it, and I had about 4 years with that kidney before I had to go on dialysis in August of 2014. And then on December 16th of 2014, I received my second kidney transplant from a friend of mine who was a perfect match, and my dad was also a perfect match, and I was very blessed to not, for so many reasons, to have two kidney transplants, and to have both be perfect matches is a huge blessing, and the fact that I had no antibodies to my dad's kidney, and as of last December, which is 9 months ago now, but as of 9 months ago, I also had no antibodies to my current kidney transplant, which is good. And I don't know if that's still the case, but I hope so. So basically, my kidney function's been good ever since the transplant. The only difference, also my FSGS is in remission for basically the first time in my life, which is an actual miracle. And the doctors, don't really know why. We didn't do anything different this time, just like standard plasmapheresis, but even before I did plasmapheresis, I started to show signs of remission, actually while I was on dialysis in the summer of 2014. So yeah, I'm in remission, which is crazy. And, I almost didn't even get a second transplant because I was so afraid of taking someone else's kidney only to have it, be destroyed by this horrible disease. I was completely mortified and I almost didn't do it. But I did, and it worked out, in terms of that aspect of it. But the one thing that they did differently with my second transplant is that they put me on a low maintenance dose of prednisone, just like 5 milligrams a day, and I didn't want to take it, and it turns out I've gotten other opinions since then from other nephrologists who said that, because I didn't have classic rejection of my first kidney, and because I had no DSAs, donor-specific antibodies, to my dad's kidney, it might not have been totally necessary for me to be on prednisone. And I'm bringing up prednisone because I've been diagnosed with secondary adrenal insufficiency from the long-term prednisone use. So that sucks. And that's been, a big struggle. And I thought that that had a lot to do with why I haven't felt well since my transplant. After my first transplant, even though the FSGS started attacking my kidney within the first few months, and I knew that I was eventually going to lose the transplant to the disease, I still was able to work. I worked full time. I had a social life. I had friends. I think I tried to make the best out of those 4 years. I think I did. I hope I did. I know that I had really good times, and I'm grateful for those 4 years. And so it's, super bewildering and very disappointing that I've been, beyond blessed to receive a second kidney transplant, and have it be a perfect match, and to be in remission of this disease. It's it's all the things that you want. It's a miracle, truly. And which makes it all the more disappointing that I haven't felt well since the transplant. And I feel a great deal of shame and failure and all kinds of negative emotions surrounding it. Like it's a personal failing or something. But I just haven't been well. I've been anemic ever since the transplant. I've lost probably half of my hair, which I know it doesn't look like it, which is, I've been very blessed with a crazy amount of hair, but I have lost, handfuls of my hair in the shower, especially last summer and fall. I'm losing less now, but I'm still losing quite a bit every time I shower. I also don't look like myself. I look anemic. I look pale and tired. My eyes are like a little bit puffy all the time. I think my face is like maybe a little bit puffy, but I don't look like myself. I don't look healthy. I look like how I feel, basically. Which, and I don't mean that to sound like it's coming from a place of vanity, because, I didn't make this video to talk about how I look, but, there is some kind of like psychological toll that it takes on you when you feel like you constantly look sick. And so yeah, I haven't felt well. I've been mostly my symptoms were, or have been up until the end of May, just like extreme exhaustion, racing heart after I take my prednisone in the morning, even though it's a low dose. Also, I've had low blood pressure since the transplant, which is weird because usually you have high blood pressure from the transplant drugs. My blood pressure was regularly like 100/60, sometimes a little bit less. So I was dealing with all those symptoms, and also like brain fog, like not feeling right mentally, and not in like a depressed sense, but just like feeling like weird, like. And I think anyone who's been on prednisone for any length of time knows what I'm talking about. Even though it's just like a low dose, it can still mess with you. Especially, getting the diagnosis of adrenal insufficiency was very validating, because not only, the prednisone that I take replaces the cortisol that my adrenal glands can't make on their own, but it doesn't replace DHEA and aldosterone, and my aldosterone level is like it's not detectable. Like there's all kinds of hormones that are made by your adrenal glands, that you need to have a sense of well-being, and I don't have them. And so I thought that was the extent of it. I thought that it was just that I was adrenal insufficient, and that was the answer to why I felt like shit for the past over a year and a half now. I forget what I was going to say. Anyway, around May, I want to say, my symptoms suddenly went from bad to horrifying in a pretty short amount of time. I noticed throughout May that I was feeling a little bit more tired than usual, and I started having really, really bad headaches. I started to just not feel right. And I started to get this feeling at night that when I woke up, when I went to sleep, I wasn't going to wake up. I felt like almost like drugged or something, like I was too tired, if that makes sense. And also my blood pressure was starting to drop lower and lower, which was also concerning. And my anemia was pretty stable during this time. Also, I had a bone marrow biopsy back in February to investigate the anemia, and we ruled out, cancer. And my hematologist said that, sometimes after transplant, some people are just anemic because your bone marrow is suppressed by the drugs. And she actually had a patient who had to stop taking his drugs because he was so anemic that he needed to get multiple blood transfusions or else he was going to die because his hemoglobin was like 3 or 4 or something. And I guess even though they stopped his medication, he didn't reject his kidney, which is interesting. Anyway, so around the end of May, I started to have really horrifying symptoms, cardiac symptoms. I woke up on May 24th, and I got up out of bed and I walked across the room, and my heart started beating erratically, like the beats weren't timed evenly, and I could feel it, and I felt it also, and it was horrifying. And I sat down on my bed and I tried to wait for it to even out and go away, and it didn't. So I called 911, and then when I stood up to go unlock the door for the paramedics, my heart rate went from, AFib or whatever it was, to just, severe tachycardia, very, very high heart rate, and I felt like I was going to pass out, and I thought I was going to die, and I didn't die. And anyway, they didn't find anything at the hospital, and they sent me home. And then from that point on, my symptoms just started getting worse and worse. The cardiac symptoms, racing heart palpitations, skipped beats, things like that. I started getting, horrific headaches. My pupils started to be dilated sometimes, and I felt like, cognitively, I felt really weird. And then I started to have severe itching of my face and my neck and my chest, and then the itching turned into burning, where it felt like my skin was burning. And my blood pressure was also continuing to plummet. It fell to like 80/40, and there was one time where it was like 83/30 something, and my doctor didn't know what the hell was going on with me, but it seemed like things were getting very scary very quickly, and I was afraid to be alone. I thought I was going to die in my apartment. I couldn't drive. I had unbearable anxiety from all of it. I felt like my nervous system was in meltdown mode. Also, I had searing pain in my kidney that radiated to my back. I felt paranoid. I felt just I felt horrible. I felt like I was gonna die, and it got to the point where I knew I was gonna die, basically, if I didn't stop taking the drugs. Or, I mean, that wasn't my first, go-to reaction, was that it was the drugs. Basically, it was my doctor who suggested finally that I might have Prograf toxicity. Even though I was in the normal range, the therapeutic range that they try to keep you in, I was still on what I found out was a very large dose, and I've been on that dose more or less for years. I was taking 13.5 milligrams a day, and I guess it turns out that most people only need to take like 2 milligrams a day, sometimes even less, to stay in that therapeutic range. But for whatever reason, my body was metabolizing it in such a way that even at 13.5 milligrams a day, I was barely in the normal range. In fact, I think I was just like slightly below it. So yeah, my symptoms were getting progressively worse and worse. I kept feeling like I was gonna like pass out or have a seizure. I don't know how to describe it, but there was some kind of feeling in my head, aside from the horrific headaches. It felt like I was gonna die, and along with like the burning skin. Also, I developed 2 cold sores on the side of my mouth. I've never had cold sores in my entire life. My white cell count was low. My white cell differential was like all messed up. It still is. And so yeah, my doctor suggested Prograf toxicity. I tried to taper the Prograf. We discussed switching me to different drugs, and there were a bunch of reasons why I couldn't do the other drugs. I wanted to try belatacept, but I don't have EBV antibodies. And the other drugs, I was so sick. I was so incredibly sick that the thought of going on to a different drug that is basically the same as Prograf or similar in terms of the side effect profile was terrifying to me. So I stopped taking the Prograf after I initially just tried to lower it. And I was terrified to even lower it because I was barely in the normal therapeutic range, and I was terrified of rejecting the kidney. And it was a really horrifying time, and not an easy decision to make, but one that my doctor understood. And then I ended up stopping the Myfortic as well. Some of my symptoms got better when I stopped the Prograf. The itching and the burning got better, the headaches got better, and the kidney pain got better pretty much right away, actually. But there were other symptoms that I had that were still really bad, like the heart symptoms were really bad. And also we had doubled my Myfortic dose to compensate for the lack of the Prograf, and I think that really did something, and so I stopped the Myfortic eventually as well. And within a day or two of stopping the Myfortic, my blood pressure went from 80 something over 40 something to like 110 over like 70, and it's been fine ever since. My blood pressure's been fine. It's crazy how quickly it recovered. But it's been very confusing and weird because because I was in the therapeutic range, or just not even, barely. It's confusing why I've had this experience. And even though some of my symptoms have gotten better, there's a lot of stuff that I'm still dealing with. I'm still dealing with headaches, although they're not as frequent as they were before. I'm still dealing with a racing heart for most of the day, like no matter what I'm doing. I mean, I can just be like sitting and reading, and my heart rate will be like 110 for no reason. And then it's like when I stand up, my heart rate goes even higher, and I just seem to have no control over it. I also feel dizzy sometimes, and I still don't feel right, like cognitively. And I'm also dealing with the terror of the possibility of losing my kidney. It's a lot to deal with, and it is it's terrifying. I keep losing my train of thought. I had a brain MRI last week that showed white matter changes in my brain. They're not too worried about it because the changes are non-specific. I also had an echocardiogram yesterday because I've had a blood test called pro-BNP blood test, which is like a marker for heart damage, like heart failure or something. I've had 3 of those tests done in the past few weeks, and each time the test comes back higher. So there's something irritating my heart, and they don't know what it is. And my instinct tells me that these drugs, I don't know if it's the Myfortic or the Prograf or it's both, but my instinct tells me that these drugs have like done something, have damaged me in some way. I mean, they're toxic drugs, at least the Prograf is. Prograf is neurotoxic, literally toxic to the brain, and it's nephrotoxic, literally toxic to the kidney, which is crazy because you take the drug so that you don't reject your kidney, but a lot of people over time end up losing their grafts because of Prograf damage, and that's why they try to keep it in a very narrow range to avoid the toxic effects. But clearly there's something they don't know about the metabolism of this drug, and why it's possible for some people to have toxicity even when they're in the normal range, which happens. Some people go into like a coma because they get like swelling of the brain or something. There's some kind of like brain disorder, like PML. I forget what it stands for. But it's serious, and it's scary that there seems to be a lot that they don't know. And because I'm still having symptoms, even though I've stopped the drugs, they're trying to tell me, maybe it wasn't the drugs making you feel sick because you still feel sick. And, even though my symptoms aren't nearly as bad as they were before I stopped taking the drugs, I feel like, if anything, the drugs have caused damage, like I said, but I don't think that they being, my nephrologist and his nurse or whoever, I don't think that they're open to that possibility that it's done something like not transient. But I'm certainly hoping that it is transient and that it clears up. I'm hoping that I don't have heart failure. I also had like really like bad shortness of breath in toxicity. There was like a few nights where I woke up in the middle of the night gasping for air, which I've never had shortness of breath before, never mind gasping for air. I don't smoke. I've never smoked. So there's a lot that still doesn't really make sense. But I'm still very worried. I'm worried about my headaches that I'm still having. I'm worried about my heart symptoms. And of course, I'm extremely worried about the prospect of losing this kidney, which is like a miracle kidney, and like a gift from a friend. It's completely terrifying, and I don't know, but I feel very confident that if I had kept taking those drugs, something serious would have happened. I felt like I was going to die, more so than any other point in my life, except for when I was in benzo withdrawal, which is another story, completely different story. I've read a lot about tolerance online, which is a very rare phenomenon where people stop taking their anti-rejection meds, and for whatever reason they don't lose their kidney or their organ. I've only read about kidney transplant. I don't know if it happens with other transplants actually, but But it's very rare. Most, the vast majority of people who stop taking their drugs do reject the kidney because you develop antibodies and it attacks the kidney. And so far, my kidney function has been good. It's stayed the same. It's been stable since I stopped the drugs. But we're monitoring it very closely. I'm getting a kidney biopsy in a couple weeks, and I'm just completely, giving it to God, as they say. I'm very afraid, but I'm also trying to have hope, because I do think that sometimes things will work out. I don't know if I'm being delusional out of necessity or what. I have no idea. I do know that I think I'm doing the best that I can, though. I'm in remission from this disease and they don't know why. And that's a miracle. And so just trying to have faith that maybe I'll be okay. But I also don't want to be arrogant, and I understand that it's easy to look at someone who's had a transplant and stopped taking their drugs and to judge that person as careless and selfish and reckless, and I totally get that. I really do. But I also think that there's no one more qualified to make that call than someone who knows what it's like to be on dialysis, and somebody who's already lost a kidney and been through organ failure. I saw a doctor last week, a kidney doctor, who was standing in for my doctor who was away, and she was like furious with me that I had stopped my medication, and she just like refused to hear me when I was trying to explain why I made the decision and how the decision was difficult beyond her wildest dreams, But it was like she was talking to me as if I had just kind of carelessly decided, like, oh, I'm not going to do this anymore. When the reality is that, like, if anybody knows what's at stake and knows what kind of suffering is possible on the other side of a kidney transplant, it's me, and I think the people who've made decisions like this, they've reached the end of their rope, and it's not their fault, and I'm gonna say that, and I'm gonna stand by it, because these drugs suck, and there needs to be better drugs. Not everybody can tolerate them for whatever reason. And I don't know why this time is different, and why I was able to live like an okay life after my first transplant on the same drugs. I don't know. One theory I've had is that the adrenal insufficiency has done something, or even the withdrawal from Klonopin that I went through a couple years ago, definitely did something to my nervous system that was very profound. And I mean, I don't know. I only have theories. And unfortunately, when you have, theories and you have doctors that aren't willing to like investigate things, or maybe they just don't have any ideas, I don't know. But they start to like think you're crazy. They start to see your theories as some kind of like weird hobby that you have or something, like you're a hypochondriac, and like you, like I don't know what they think, that like you enjoy investigating made up medical mysteries. I have no idea, but I know that I've been treated very, very condescendingly and just horribly by some doctors. I would love to hear from people who've been through anything that I've talked about so far, transplant of any kind, trouble with drugs, anemia that doesn't get better, nervous system dysfunction, toxicity of the drugs, any of this, tolerance. I think I already said this at the beginning of the video. I don't remember. I also can't remember stuff. I just feel like my brain has been fried or something. But I also want to let people, anyone out there who's having trouble with a transplant, and feeling ashamed that they're not out there living their best life. It's a horrible, crushing shame because you know that somebody has made this decision to help you in a way that is really above and beyond any other kind of help. And that's a huge thing that you carry with you when you have an organ transplant. But I want to let you know that you're not alone, and that so many people struggle with the drugs and with adjusting to the physical changes and the psychological changes after transplant. It's such a huge, life-altering thing, and it goes way beyond the physical aspect of it. It really does something deep to you, that's kind of hard to articulate if you haven't been through it. It's life-saving, and it's so many things. But yeah, I would love to hear from anyone who knows anything about any of this stuff. Thank you.